The Metaderm was not started like this. It was started in a very small way. Metaderm was started in a 250 square feet small space, and the place that we are in today is truly because of the trust and confidence our patients had on us, and we are truly grateful for that.
So when I was 13-year-old, I thought it was just a vitamin deficiency, like they say this poochi irukku solluvaanga, so it was like that. So I didn't take any sweet and I went on diets and everything, but then I didn't really take it like that much bad of it, because at that age I didn't know what was it. I wasn't really worried about my looks at that age, so I just concentrated on my schoolwork and all that.
I sometimes feel like a detective, and it's incredibly gratifying helping people get their life and skin back on track, seeing them regain their confidence, and that truly makes a difference. I think that's the most rewarding part of what I do. Hi, I'm Dr. Vilashni Santosh Kumar. I'm a board certified consultant dermatologist registered with the Indian Medical Council. I'm a big believer of catching things early. I can tell you if you're going to develop diabetes or a liver disease years in advance just by looking at your skin now.
So noodles வந்து என்னோட favorite food, but psoriasis இருக்கனால என்னால ஃபுல்லாலாம் சாப்பிட முடியாது பழையபடி.
But சில foods which will trigger அப்படினா it's maida,
dairy products, like that.
So you can't eat your favorite food and all.
Yeah.
I am focused on procedural and clinical dermatology. So that is essentially solving skin mysteries, diagnosing and treating skin conditions, cutting, popping, peeling and squeezing things out of the skin. There is a lot of science behind medicine, obviously, but more than anything, it is an art. Sometimes something as simple as just smiling at a patient when they enter the room will make a huge difference. You have to listen to them genuinely. You have to show them that you care, because sometimes there is no cure. Sometimes patients walk in with terminal illness and there is nothing much I can offer in terms of treatment, but just being there for them, listening to them and offering that comfort means a lot.
So this is our sunscreen space, ma'am.
Here at Metaderm, we are staffed with professional people who are intelligent, warm, most importantly caring. It's not just work for them, it's beyond that.
Would you like to have tea, coffee, ma'am?
No.
Water?
Hi, I am Kavya, pharmacist at the Metaderm Center.
So we prioritize on patient satisfaction by providing them with personalized care and attention throughout their journey.
We have different type of patients visiting our clinic with different concern. After the consultation, they are getting a proper clarity, and while that can be seen on their face, after seeing the patient's face happy, we are also happy.
And when they go out with a smile, we also feel very happy, and we feel very satisfied to work here. I am very proud to be the part of Metaderm.
பூச்சி இருக்கு, பூச்சி எட்டி பாரு, எட்டி பாரு, பூச்சி இருக்கா? இது எப்படி, இது மூன் மாதிரியே இருக்குல்ல பார்க்க, இல்லை மூன் பார்த்துருக்கியா நீ? Did you know that skin is the largest organ in your body? When you reach out to specialists for issues with other organs such as your heart or lungs, why would you settle for anything less when it comes to your skin? Would you get a heart surgery done by a dentist? No, right? Then why risk your skin? To become a board certified dermatologist, you have to go through 4 years of medical school, then do an internship in internal medicine, general surgery, pediatrics, then take up the board exams to do 3 long years of dermatology residency, and then do 1 to 2 years of fellowship in subspecialty. In India, the ratio of qualified dermatologists to the number of people is 1:140,000. With this huge demand for skincare, people resort to taking treatments and advices from all sources. Good quality expert care from qualified professionals has become very expensive. We here at Metaderm aim to provide expert quality dermatological care at affordable prices and to ensure everyone has easy access to the best possible skin and hair treatments. So when I think of cosmetic dermatology, I think of three things: technique, technology and artistry, and I think all these three have to work together. Now if someone exceeds in artistry but doesn't have good technique or technology, they are kind of limited in terms of the results that they can provide to patients. On the other hand, when you are able to harness all three, when you have a good sense of artistry, when you are skilled from good training and good experience, and when you have access to cutting edge technology, really magical things are possible. We have been looking into this industry long enough to understand that it's important to find solutions for a long-term plan instead of doing a quick fix. It's not about the fine lines, it's not about the pigmentation, it's about finding the root cause of what exactly caused it in the first place. I usually listen to the patient about what their concern is and try to address that particular concern first. Before any treatment, I listen. We talk, sometimes over a tea, so I can understand them and not just their face. I often study their photos and reflect before deciding on a plan, because true aesthetic care begins with understanding their life and not just their looks. People have a lot of choices when it comes to hair restoration, but one of the things that sets Metaderm apart from the rest of the industry is our focus on results. Coming from a family of doctors, we know how important it is not to compromise on the quality of the treatment. Our treatments have been proven effective till date and our patients are absolutely happy about it. Medicine in the past waited until you got sick, but now we know in many ways how you're going to age, what your susceptibility to diseases are, how your hair and skin is going to look like in the next 10 years. I strongly urge you to take a consultation at the Metaderm for science-backed technology and for a deeper understanding of your skin and hair needs.